The Ghana Health Service has confirmed the detection of highly contagious variants of coronavirus Delta at the Achimota School in the Greater Accra region. It follows an earlier report by the health management body that a senior high school had recorded the Indian strain. According to Dr. Achimota School, Director General of the Ghana Health Service, some 3 students of the school initially presented influenza-like symptoms at the school's sick bay between June 14 and June 16, 2021. They were tested in line with laid-down protocols and all 3 results turned out positive. They were isolated and all contacts placed under mandatory quarantine on campus. Subsequently, more testing was conducted in the school. Dr. Achimota added that majority of the students who tested positive are, however, day students.
We had a significant number of the initial one we did in Achimota as the Delta variant. And so once you do that, you assume that because it is a source that will spread around, you would assume that the majority of the variant will be the Delta variant. And that is why we are doing the strategic testing of day students to ensure that it doesn't spill significantly into the community. We are now going to follow them up to their homes and see how we can enhance contact tracing and do further testing for their contacts. And at the same time, those borders and things that they've come in contact with be tested. Just this is to help assist us bring the outbreak to an end.
Over 2,000 students in 351 schools at all levels got the COVID-19 virus. Out of that, there are 46 cases in Accra and 2 cases in the eastern region. So far, Ghana's active cases stands at 1,619 with over 700 deaths. According to Dr. Achimota School, most of the cases were detected at the airport amongst international arrivals.
Among the international arrivals at the airport, as of 7 a.m. on the 1st of July, total case of about 1,897 has been recorded positive. We've done about 339,000 plus tests with a positivity of 0.56%. And as we've said, the males account for the majority, about 63%, but about 58%. And most of those arriving at positive are non-Ghanaians, which is about 58.6%. We've actually have a relatively low figure in the last, in May, June, compared to what we had in the previous months. But you can see that July has just started, we have 10. But in June, we had about 134. What is clear, what is strange, about 50% of all of them have come from Liberia and Sierra Leone. And so these become countries of concern for us, and that we are having other additional measures to deal with the situation.
On the side of the students, Director General of the Ghana Education Service, Professor Kwesi Opoku-Amankwa, says measures have been put in place to control the spread.
I want to assure the entire country, especially for parents who have their wards in boarding schools and also in the Achimota, that every measure has been taken to ensure that we contain the spread of the virus. We have done fumigation, disinfection of the key areas, but we are also going to continue to do the Achimota community.
Director General of the Ghana Health Service, Achimota School, advised Ghanaians to intensify their adherence to the COVID-19 protocols to avoid contracting the new variant, stating that the Delta variant has a higher transmission rate.
The non-adherence to the COVID-19 protocols is a concern, and the confirmation of the Delta variant in the community is a cause of concern. So we urging all, please, that you don't need any further measures. All the measures still work. Your mask, social distancing, hand washing, and avoiding crowds is very important, whatever the variant you have. And so we need to be sure that this is really fully enforced.
He also hinted that there are indications of getting more vaccines towards the end of the month.
A lot of going on. We have some indication that we may be getting some vaccines probably towards the end of the month. But you know the challenge. A lot more is going on from COVAX, from the donation from America, and of course, effort to buy. So all those is ongoing, and I'm sure at the appropriate time, everybody will be vaccinated.